Let's react to a video by Alanah in real life. It's called I Got an Eyebrow Hair Transplant.
So today I'm doing something that a lot of you will have heard me speak about before. I mentioned my interest in doing it in previous videos and certainly on streams. And I know it sounds pretty crazy, but I'm really excited to do this. I am getting an eyebrow transplant.
And I offer that in the practice, so I have a lot of experience with it. And I'm really curious to see what her reasons were for getting it and also just her experience.
We've had many a journey with my eyebrows, but basically I have eyebrow tattoos. It's called microblading. Still held pretty well under this eyebrow, but I don't have a lot of hair. This one is a mess.
So the microblading refers to small strokes of the ink that is placed in a kind of a superficial way just under the skin surface. So it's kind of like a temporary tattoo, but does it ever truly go away? That's less clear. I think it always kind of sticks around at least a little bit. It does fade in color over time, but it's, I think, debatable whether or not it completely goes away. But there are also people who get other types of tattooing done that isn't necessarily microblading. So that's something to keep in mind.
Why does it go down and then up and out? And then but there's like almost no hair here. Garbage eyebrow.
And eyebrows can sometimes be thin for people from an early age. And other times as we get older, the eyebrows can thin. And that can be because of an underlying medical condition. Like I have alopecia areata, as you guys know, and that has caused my eyebrows to pretty much be completely absent. But there are other types of medical conditions that can bring that on, such as different thyroid imbalances and other types of nutritional deficiencies. So there are different reasons for why people have thinner eyebrows or absent eyebrows. There's also scarring alopecias. So some women will develop frontal fibrosing alopecia where the hairline starts to recede back in women. And also usually it's associated with a thinning of the eyebrows. So it's something important to keep in mind, like what is the actual underlying cause? And if it's something that's actively going on, like active inflammation, you don't want to be transplanting that type of patient.
I don't tend to wear really any makeup these days. All of my makeup is technically just different sunscreen, but I do feel like I need to fill in my eyebrows every single day because this eyebrow, I just think looks so dumb.
And some patients tell me that that process of filling in the eyebrow can take them hours every single day. And that's a huge burden for many people. And it's not just women who come in wanting an eyebrow hair transplant. Men as well can experience this type of thinning, or sometimes like the lateral portion of the eyebrow is especially prone to thinning out in men with time. And they want to restore that because it helps give you some framing and structure to the face.
I feel like I have like kind of a weird Jack Nicholson thing going on. Like, why does it split? I hate it. I hate this eyebrow.
It's just the drop in density right after the arch of the brow that she's observing there.
Every time that I do my eyebrows, I'm not able to get them even.
And the eyebrows will never be the same. Even after surgery, it's impossible to make them perfectly symmetrical. They always have a slightly different characteristic from one side to the other. And it also, when you look at the whole face, it's typically asymmetrical in everybody, right? So trying to get the eyebrows exactly the same from side to side is literally impossible. But trying to get them to match a little bit better is usually something that surgery can help with.
So by the end of a day, I'll look like I've got one fairly normal eyebrow and one no eyebrow. Part of this is I have really naturally oily skin, so microblading doesn't last. You do have to redo microblading anyway. But basically, like, the last 2 weeks of me doing my eyebrows, I've just been like, oh my God, I'm so excited for this transplant so I don't have to do this anymore. I just want eyebrows.
There's still some upkeep after an eyebrow hair transplant. Remember that the hair typically comes from the back of the head, so it's going to grow long. So you need to trim that hair, usually every week at a minimum, but some patients actually trim every 2 to 3 days. It depends at what length they like to have their hair. I have some patients that really like to have the eyebrow hair super short, actually, which sometimes surprises me because I think that if it had a little bit more length, it would just give them that added fullness, but not everyone wants that. So some patients have it shaved down or trimmed down really, really short, whereas other patients like that kind of longer look to the eyebrow hair. So once you have the hair there, you can decide how to groom it, essentially.
I just want them to be there. and then just not have to think about anything ever again. That's what I think is going to happen, is I'm going to get some nice new eyebrow hair, and then I will never have to think again.
Well, no, you do have to think about it because the hair is going to keep growing long. So that's not going to look right either. So then you'll have to trim it. So you have to be aware of at least, that type of maintenance post-op.
I spoke to a number of surgeons. This is a minor surgery.
It might be a minor surgery as far as overall risk, right? But it is definitely not minor when it comes to skill level. There are many doctors out there and many clinics that offer hair transplant surgery. But I would argue that only a very, very small percentage of those types of clinics actually do eyebrow hair transplant surgery well. It is a very technically challenging procedure, and it's something that's deceptively difficult to get right. It's not hard to just put some grafts in there, but if you really want to do it properly and follow the right orientation and the right density and really spend time marking the patient out and getting the look that they want, I mean, that takes, first of all, it just takes time. So we usually start around 7 a.m. and we finish eyebrows by around anywhere earliest would be like 2 p.m. and sometimes we're done closer to 5 p.m. just for an eyebrow case, and it's not like the same number of grafts as scalp cases. However, it's very technically challenging because of how delicate the area is. The skin is very mobile. We're talking about very, very small blades that are used to create the sites, and then the grafts have to be placed one at a time, and you have to observe the curl of the hair so that you place it flat to the actual skin so that you don't have too many hairs growing out this way, because then that looks unnatural. So it's a tough procedure. So yes, it might be minor in risk, but I think about it as very major as far as skill level required to consistently perform and to have really nice eyebrow hair transplant results. And we have a video that we put out about like the step-by-step of someone's surgery that came through my clinic. So make sure to check that out.
And an eyebrow transplant takes a very long time.
Yes, so absolutely. Just what I was saying before, that it is a difficult procedure that requires really high level of skill, not just from the surgeon, but also from the surgical team. And not every hair transplant tech who places grafts can actually place grafts into eyebrows well. So it has to be a well-coordinated procedure between surgeon and staff. And I think it's something that is definitely underappreciated as far as how difficult these procedures actually are, especially within the realm of hair transplant surgery or hair surgery. This is one of the more challenging procedures, in my opinion.
I have to get there to Beverly Hills at 7:30, and then I will be there until about 2 p.m. This is not a surgery that I go under for. I will be sedated. I'm taking some Valium, but I think I'll probably fall asleep realistically.
Yeah, usually this is something that just requires local anesthesia, like lidocaine with epinephrine, and then sometimes some oral sedation like Valium or Ambien that typically gets people through the procedure quite nicely.
And I imagine I will take a little nap on the table. It takes a long time because basically what they do is take hair from the back of my head. I will have an incision on the back of my head because they're like literally removing a chunk of my skin to get hair follicles.
So there's two basic ways to get the hair, right? There's the FUT method and the FUE method. And we have so many videos on those two different types of extraction methods, and we'll link to one of the videos here. But FUT is actually my current preference for getting the grafts for eyebrow work as well, and that's because we can keep the actual hair shaft longer, and so we can see the curl of the hair better. Now, there is a caveat there, which is that there are some FUE punches that are now being made with an opening on the side, a little slit that allows you to more easily harvest long hairs. So not every system that exists actually has that type of punch currently available on the market. So our system is the WA system by Dr. DeVroy, and he's still currently working on that special type of punch. So once that becomes available, and if we like how it works, then we might switch over from FUT to long hair FUE. But there are some systems on the market that allow you to do long hair FUE already. So just wanted to throw that out there. So you don't necessarily always need to do a strip or an FUT type of excision, but I think that it's still a great way to reliably do this procedure. And since you don't need a ton of grafts for eyebrows, usually somewhere between 500 grafts and let's say 700 grafts for a complete procedure for both eyebrows, the actual length of incision that you need to create on the back of the head is not terribly long. So usually around 6 to 7 centimeters in length will get you enough hair to do the procedure. So then at the end of the day, you get a linear scar that's buried within your hair, and it's about 6-7 centimeters long, like a thin line.
And then they put those hair follicles in my eyebrows. And then the after is a whole thing. I'm expecting today to come home a little bit sore, obviously. I'm expecting to have bruising around my eyebrows. I'm expecting it to be a little bloody or a little crusty.
She's definitely right about all those things. You get swelling, you get bruising, and so you have to pretty much expect that you'll have about a 1 to 2 week sort of immediate downtime. And then, of course, it's going to take time for your hair to actually grow in. So usually the hairs actually fall out after a few weeks, and then the regrowth starts around 3 to 4 months after the procedure, and it grows gradually over the course of like the first year.
I'm not allowed to wash my hair for 3 days, but I'll probably wait longer than that, to be honest.
We tell patients to keep the eyebrows completely dry for 6 days. Until day 6, they really shouldn't get water on the eyebrows. Those are our instructions. Her surgeon might have other instructions, but that's what we find is the safest for, just not getting any of the grafts to fall out.
I'll have a bunch of scabs, then those will fall off, and it will actually take like a good 6 to 9 months before we actually see the new eyebrow hairs come in.
Usually they start to come in a little bit sooner than that, around by month 4, usually we'll see some signs of hair. But to start to see that fullness developing, then sure, you're waiting until at least month 9 to really have a lot of the fullness there. And then even up to a year or even a little more than a year, the hair will continue to grow in.
Fun fact, the new eyebrow hairs will grow like a hair on my head. So if I wanted to, in theory, I could just keep growing. I could have an eyebrow that big. Maybe I do want to do that.
Caterpillar brows. And to reduce postoperative bruising and also intraoperative bleeding, it's important to stop a lot of the supplements that people take because they will often thin the blood, especially like fish oil, like that kind of stuff can really thin the blood, vitamin E. So we recommend stopping most of those vitamins at least 2 weeks, sometimes even longer if you can, before surgery to minimize the bleeding during the surgery so that your surgeon and the team can really see everything that they need to see, but also to reduce that bruising after surgery. And we also give some arnica for reducing bruising post-op, but you would take it as a pill rather than the topical arnica.
It is a minor surgery, but it feels like a very safe procedure in the grand scheme of things.
Yeah, I mean, it's safe in the right hands. Things are generally safe if performed by the right person. And it can quickly become unsafe if it's in a place where they don't do this too often or they don't have, the right safety protocols in place. So I'm sure she's going to an expert in this procedure.
Yeah, I'm excited. I feel like I'm just going to take an elaborate nap. It's just a very expensive nap. So let's do it. Okay, everybody, I'm on my way home. I have...
Oh, so she didn't show anything from the actual surgery. Oh, interesting. So this is, I guess, immediate post-op. What I'm seeing here is swelling, which is totally normal. You can also see that there is bruising already around the eyebrow. There's not too much of it, but you'll probably have more in the coming days. But you can already see that there's some bruising, which is normal. And you can see that they've inserted all these grafts, but they've cut them quite short. So usually we place them in longer, but then when the person's ready to leave, we trim them down shorter. And you can see that there's like this dry blood, and you can see the grafts there. So all of that is looking normal.
He pulled out tools to measure, to make sure things were the same size and the same angle I said I wanted more fullness and that I like a straight brow, but yeah, it was like so perfectionist and meticulous about it.
Yeah, that's what it takes for eyebrows. I mean, it always takes time to get the eyebrow designs done properly. Sometimes the design is already there for you and you're just filling in density, but oftentimes you have to do some shape tweaks, adjusting the length of the brow, adjusting the height of the brow, adjusting where it starts medially, like how far towards the middle it starts. So there's lots of different variables and factors to consider for sure.
And then they gave me some Valium. They shaved a bit of the back of my head and then I guess like cut hair follicles out.
Yeah, usually for FUT, you just shave the part that you're actually going to be removing. So when you're done removing it and you stitch the two parts of the scalp back together, you just get like a line of stitches. You don't get like a big shaved area. If we're doing FUE, for eyebrows, I mean, we'll usually do like a more of a no shave approach, but also you can do a shaved section as well for FUE and then extract one at a time.
And then, yeah, I had the Valium and I laid down.
You can see that's the doctor applying the betadine, and that helps with the sterilization aspect of the procedure.
And I slept the whole time.
So you can see he's using bent needles to create the actual slits into the eyebrows. That's definitely one approach. I usually like to use custom cut blades. That's typically my go-to, but they're both extremely valid ways to actually make the little holes that then later get filled with grafts. And I like this method. He's starting around the perimeter, and that is a great way to make sure that the markings that you initially created are followed and observed with the way that you're making your sites. Because after a while, there's blood and you're wiping, and you can wipe off the markings if you're not careful. So we always start with creating that outline and then working in to start to build up density.
It was more chill than when I had my microblading done.
And you can see now they're using forceps to carefully place the grafts in the proper orientation, following the curl, I'm sure, and that is now this last part of the procedure. First, you have to make the outline and the design, then you harvest the grafts, then you're making these sites, and then of course you have to implant the grafts.
Day one, we'll document the next 5 days because I'm allowed to wash this ointment out after 5 days.
Yeah, that's pretty much, close to what we recommend. Usually for us, it's on day 6, but, close enough. It takes about 72 hours for the grafts to really secure in place on the inside. So I think generally it's very difficult to disrupt them after about 3 days, but it's always better to be safe than sorry.
That's how I look like right now. I'm expecting more redness and more bruising tomorrow. This was the bad eyebrow. You can see it's got hair now. I am so excited about this. I have just woken up on day 1 post-op. Extremely pleased to report today though, even I'm surprised. I am in absolutely zero pain. I did not have trouble getting to sleep and I feel nothing.
Pretty common. This is not a very painful procedure to recover from, which is great, but definitely bruising and swelling can pick up. It might not be as prevalent post-op day 1, but it can sometimes get worse with day 2, 3, 4, and then it starts to slowly improve.
They gave me some painkillers. I have a certain amount of painkillers and they're not strong painkillers, and I knew that because the pharmacist told me, and I was like, oh, that's interesting, not very strong. Now I get it. I don't even need them. I'm in absolutely no pain at all. So I have this big incision on the back of my head, right? And that feels itchy, not sore, not in pain in any way. And my eyebrows, I feel nothing.
We typically use non-dissolvable stitches in the back that need to be removed in the office. And we typically wait about 10 to 14 days to remove those stitches. Now, some people use dissolvable stitches, and that's fine too, but I find that the healing is optimal when they're non-dissolvable, so you get less of an inflammatory reaction on that area. And then the only downside is they have to return for suture removal. Sometimes patients will actually travel to wherever they live, back home, and then get it done locally with a doctor closer to home. That's also acceptable if they find someone else who's willing to remove those stitches. But of course, we always prefer to see our patients back for suture removal.
Also maybe a little itchy. I will admit I do really want to touch them, but I have been told It's the one thing I'm not supposed to do.
Sometimes if you're itchy for like nighttime, you can use some Benadryl, like a pill. But yeah, you don't want to be taking Benadryl during the day because it can make you drowsy. And you definitely don't want to be picking at the area because you can pull the grafts out.
So they still have all the ointment that they put in there. So that they look, my whole face is very oily actually. And that's just my face. But yeah, you can tell they're like sort of wet. I was also expecting to be really bruised today, and I'm not. But yeah, I expected to be like fully out for several days, like do nothing but work on my laptop. And it's not like I'm not gonna just work and play video games, but yeah, I thought I would be kind of bedridden, and I'm not at all. I am fine. Yeah, piece of cake.
Yeah, we definitely recommend that people don't go like working out in the at least the first week, and after 1 week they can do some light activities. Full workouts usually after at least 2 weeks. But yeah, I mean you don't have to be bedridden. You shouldn't be bedridden. It's not good for you. So definitely want to be mobile. You want to be walking around, doing things, but doing things carefully.
Just waking up on day 2, everybody. Still no bruising. Swelling is going well. Absolutely no pain. This has been so easy. I am amazed. Like I said, I just went in, took a nap, and then came out with some eyebrow hairs.
See that redness that you're seeing there, the pinkness, the area that was worked on is very normal. It, of course, is going to be a bit irritated because of the manipulation that was done, but that pinkness will start to fade over the course of weeks to months, and then it goes away.
Good morning, everybody. I've just woken up on day 5. Yeah, I had nothing else interesting to report. Nothing has happened. I have no pain, no swelling, no bruising, nothing. But I did realize, and yes, I slept with my eyeliner on. Don't judge me. I did realize, though, that I keep saying that they probably look dark because there's like blood or whatever in them, because I completely forgot, and this is probably because of the Valium, that we actually dyed my eyebrows. My natural hair color is like a dark blonde, I think is what hairdressers would call it. You could call it light brown if you like. But because obviously I bleach my hair to be virtually white, the transplant, if they had just taken the hair from the back of my head and put it in my eyebrows, I would have had like a bunch of white hairs. So after shaving the strip in the back of my head, they then dyed it brown.
Yeah, we sometimes will dye hair as well, so we can just visualize it better when we're doing the procedure. It's not so much because we want people to recover with a darker, eyebrow color, but it's really because it allows us to see better when we're doing the work. And we'll sometimes do that for scalp procedures as well.
And so the hairs that are in my eyebrows right now are darker than I'm used to, because they're darker than my natural hairs because we had to dye them brown.
I think the darker color looks nice on her, actually.
But today, we can see they still, got some gunk going on. We get to wash them. I'm very excited. Let's do it. Okay, excuse the fact that I'm in a towel, but I decided to just also wash my hair, just do the whole thing. And I had to be very gentle with the eyebrows for obvious reasons. They told me to be super gentle, so I was really careful, but I'm amazed at how good this looks. This is crazy.
Yeah, and I mean, the satisfaction rates after well-performed eyebrow hair transplants are extremely high. I think it's important to keep in mind that some people return back for some touch-up work. Like there might be some areas, especially like let's say at the head of the brow, where she might just want a little bit more density, or let's say on her right tail of the brow where she didn't have too much hair, she might just come back wanting a little bit more. But that's easy enough to do down the road once things heal up and once the hair fully grows in. As long as the initial procedure is performed properly, it's not difficult to build on that with some more density. So that's something just to keep in mind with any hair transplant. There's always the potential that someone might want just more density, or they might want a little tweak, and can you send this a little bit down, or can you adjust the the arching of the brow a little bit. So those little changes can be made down the road if needed.
This is just how my eyebrows look now. So there's still like a little tiny bit of scabbing. This one worse than this one. Wow. You know what I didn't account for? I knew that this would make my life easy. I was like, great, I'm not gonna have to put makeup in this eyebrow all the time. I didn't consider the confidence boost that I would also have from this.
That's what we're talking about. Feel confident, right? Because a lot of these procedures, that's really one of the main things that they do is that, first of all, they help you just with not paying as much attention to the area, instead of spending hours on it every day. But also, of course, overall, just boosting your confidence. That's why a lot of people get these types of procedures done.
I was like, this is going to make my life easier. I'm not going to have to put makeup in the morning. Great, let's do it. I didn't realize that I would look at it and go, oh my God, the eyebrows look beautiful. I'm so happy. Look.
I also think the darker color actually looks great on her. It almost helps highlight the darker color of her eye. So yeah, that looks great.
I can't believe these are my eyebrows. So yeah, you can see we've got all the hairs here. That's still obviously still, sorry, I'll try to make that focus. So you can see all the hairs here.
And remember, most of those hairs will actually fall out within a few weeks. That's a normal part of the recovery process.
Obviously I still have microblading underneath, but I feel like that kind of works in my favor. And on this side, dude, I'm in love. I love it.
This is the type of reaction that we always hope to get after any cosmetic procedure. So it's nice to see her happy and content with the recovery so far. So this will be my last update on this. It was very easy top to bottom. I get my stitches out next Monday, I think, from the back of my head. See, they also use non-dissolvable stitches because that's typically how you get the best healing for the back scar as well. Which I was going to show you, but it's basically just a straight line incision that I'm having to put, what's it called, biotracin ointment on a couple of times a day. There's not much to show you, and it's also difficult for me to film that, to be honest. So my understanding of what's going to happen now is that these hairs will fall out, and then the new hairs will grow in a few months' time. I'm in love. I'm so happy. The new hairs will start to grow in around 3 to 4 months out, and it's just going to continue to build each month after that. I'm so happy. Again, I didn't consider that I would find this aesthetically pleasing. I just figured I would find it easier. Oh my gosh. And it's been the easiest recovery of all time. Absolute piece of cake, top to bottom. It's always ideal when it's both, right? You want it to ease your life potentially, but you also want it to be aesthetically pleasing, of course. So that makes sense. Thank you, Alanah, for sharing your journey and for being so open about it. And hopefully everyone learned something here. If you have a question about eyebrow hair transplants, make sure to put it in the comments below.